you had mentioned that a high percent of these children with gender dysphoria would actually kind of grow out of it, left alone. Do you have any actual percents of what that might be is part of my question? And then kind of a second question, not quite related, but when you start with puberty blockers, for example, is there any turning back, or does that start down a path that there's no coming back?
Okay. So the first part of your question is that there have been 11 studies of children following young children for 10 years, up to 10 years into adolescence. All 11 of those studies have found that the majority of the children outgrow it. The majority. The highest one is like close to 90%, but there's some have been in the 60% range, you see.
Still very high.
So that's very important for us to understand, because it feels to me like there may be an ethical question here about intervening when children would desist. It seems to me that why aren't we talking about the ethics of that? The second part of your question, just give me a word reminding me what it is.
Yeah, well, if puberty blockers are started.
Oh, reversible.
Yeah, right.
Yes, sorry. So a child can take puberty blockers and stop them, and I would imagine that I think my colleague will have more expert opinions about this, that the sooner you stop them, the more reversible they would be, both psychosocially and medically. But as I've said to you, in some of the articles, the more careful authors talk about putatively reversible, meaning based on our knowledge, we think they're largely reversible, but we don't really know what the long-term effects of any puberty blocking agent for how long is. I don't think the specifics are very well known. But certainly the answer to your question is if I give a child a puberty blocker for 1 year and delay their puberty, when I stop that, the pubertal processes will return. I don't think we ruin the capacity to go into puberty. We just delay the capacity. Whether it's the same pubertal response that would have been naturally, I will leave to my colleague to talk about. I don't know.
Just to continue the dialogue a little bit further, when there's puberty blockers, and at what point then does surgery generally happen, and is that outcome generally that an individual is going to be sterile? Is that correct?
The recommendations from the professional societies is that surgery not be done until the age of consent. There are some softening of the guidelines saying under circumstances where there's emotional duress that top surgery, so-called, in females could be done at a younger age, perhaps age 16. And those are sort of soft opinion pieces. They're not actually in the guidelines yet, but in practice, I don't think that many centers in the United States are doing surgical procedures on the bottom surgery, so-called, in kids before their 18th birthday. I think they're waiting for the age of consent for that. The outcomes of the surgeries, just to think of what you're doing anatomically to try to create. It's taking a breast off the chest is done surgically for breast cancer. It's done for adolescent males who have incredible breast tissue development during their adolescence that doesn't resolve. It is a very delicate operation done to create a totally normal appearance of a chest wall without a breast, is done by a plastic surgeon to retain the innervation and the blood supply to the nipple, the areola, so that it doesn't slough off and leave a scar. The surgical incisions are carefully made to be able to contour what looks like the natural curve of the nipple on the breast, and the patient has that tissue removed. That can be done, and it's done in kids, and it's known to be, when done well, have a reasonable outcome. What we have seen openly on the internet are the disaster cases where there is really incredible scarring and sort of a disruption of the anterior chest wall that looks nothing like a normal chest in these patients. And if that could be that the surgeon that did that was not the appropriate surgeon and didn't use appropriate techniques, but it's still an outcome that can happen if not done perfectly. That's the top surgery. Again, you can't put that breast back. That's not reconstructible in any way. You can do a look-alike. You can create a breast and a nipple out of skin tissue and artfully put that back to appear to be a breast, but it's not a functioning breast. In terms of removing the genitalia in a male, taking off the penis and using the skin of the penis as a sort of an inside lining of a hole that's created in the area we call the perineum, which is above the rectum and below where the penis was. You create a channel in that tissue that is constantly compacted by the anatomy of the male pelvis, the bones that exist there. And you put in there the skin. It's skin tissue. It's not a mucous membrane. Mucous membranes have moisture and secretions to them that lubricate and that protect from infection. That cannot be recreated in the sense of a hormone secreting surface the way it would be for a vagina. So it's essentially a place to try to in which to have intercourse, which needs constant attention with dilation, and it often malfunctions. And in the case of using intestinal tissue to create that lining, ruptures and causes infection and damages the urinary tract. The exit from the bladder is disrupted, so that you have urinary tract infections and whatnot. So the surgical procedures are attempts to create nature that are, at this point in time, completely impossible to do. You can have it might look like it, but it doesn't work the way that tissue was. The fake created penises that are sewn on the perineum of biological females have no erectile function. They have no secretion. They have no innervation. They are essentially just a limp piece of tissue that hangs down and looks like a penis, but has no function of the penis. You can create a sac of tissue and put in two artificial implants that look like testicles so that hangs below that penis, but those testicles have no function and the penis has no function. So you are really doing a disservice to the patient even in insinuating that their sexual anatomy will have any physiologic function. It does not.
Wow. So just kind of a follow-up. Are there any studies kind of on the horizon at all on any of this?
Well, the problem in trying to do studies is the ethics of the study. So those of us who know from, again, the disease states where hormones are missing or are excessive in otherwise healthy humans, it would be considered unethical to do a study where you just, took a group of 20 kids and said, we'll see you in 20 years and let's see what happens. I mean, I can't envision that any institutional review board or committee for protection of human subjects would allow that to proceed.